For weeks, we've been talking about the fight over child care funding in Colorado, and the start of the year, the Trump administration froze some child care funding to Colorado, saying they're worried about benefits going to non-citizens. A federal judge intervened in the case earlier this week, saying the funding must go to the states, but we expect the legal back and forth to continue, and Colorado families are the ones that's stuck in the middle.
Dr. Rosemarie Allen, our 9 News race and culture expert, is with us here this morning to talk about this topic. So, Doctor, let's start with, what are some of the specific ways families would use this type of funding?
Well, you know, CCDF, we call it Child Care Development Fund, it was actually created to help states subsidize child care for low-income families. So for families, it enables them to work. We serve about 30,000 children. That allows them to be in an early learning environment while their families work. And also it stabilizes the child care industry in terms of finances and making sure that children are there to be served.
We have been so blessed to have family here to help us out in those early years. And that's really so hard. But we've talked about just how expensive child care, daycare, or that early education can be for kids.
Oh my gosh, here in Colorado, in some cases more than college cost. So you can imagine when families no longer have access to these funds, what happens?
Yeah.
They're forced into unstable child care situations, sometimes unsafe situations. They may lose their jobs, they may be laid off, they may have housing instability, food insecurities, and really just take a deep dive deeper into poverty.
Obviously, these changes are also going to impact anyone who works in the child care industry. Can we talk about some of those impacts?
Absolutely. I have to say that our early childhood professionals are the most overstressed, overworked, underpaid ever. They're already in a stressful situation. We talked last time about how CCAP was frozen in many counties. So many closures, many classrooms closing. So now we may experience more closures. More people may be left out of work, laid off, and also people may just leave the field because it's so unstable. But imagine, we're talking about CCAP and we're talking about subsidy. When centers close, everyone's impacted. Those who can pay the high cost and those who are receiving CCAP.
Well, we've talked about how there's just such a strain on these centers. There's not enough. The waiting lists are long. It's very expensive. It impacts so many people. For anyone who hasn't had to use this, like myself, I'm a parent, but I haven't had to use this. How exactly do these families use the funds?
Well, the funds, and this is what's so amazing because Colorado, talk about fraud prevention. Our state funds are distributed to the counties. And they determine eligibility. And parents have to be reauthorized regularly. And on top of that, licensing is also covered by these funds. So licensing professionals are in those centers at least once a year. But if there's a complaint about a center, if there are concerns about a center, then specialists can be in a center 3, 4, 5 times a year. So we can see what's going on, and that's the way that we can address fraud when it's seen. So we're not concerned at all about fraud. When I was a state administrator, we found that there was about 7% fraud. So 93% of folks using CCAP were eligible for CCAP. So we're going to be, the state will be responding to the request of the federal government, and we have no concerns about being able to meet those needs.
Dr. Allen, this is my first time working with you, but I'll tell you that Corey had a lot of nice things to say about you before this meeting. We're out of time for now, but we do appreciate you coming in this morning.
Thank you so much for having me.
Okay.